Nurses spend approximately 30 to 50% of their time caring for patients. During this time, nurses may experience abuse when their responses or treatments don't satisfy the patient or family. Being in a hospital is stressful enough for most people, but add factors such as acute disease processes, heightened states of emotion in patients or families such as anxiety, fear, helplessness, grief, frustration, or lost control. Specific personal characteristics and serial perpetuators may lead patients to act violent towards nurses.
Yeah! 21! We're fucking 21! I can't believe it, man!
Alright, come on.
I got some of this stuff. Let's do this. Let's do it. That'll be yours. Let me get mine first. Now I'll fix you up, okay?
Okay, sounds good.
Man!
Alright, my turn.
There you go. Get it in line for you. There you go. There.
Cody, can you breathe? Alright, someone call 911. Cody, we're in the hospital, okay?
Why?
We're in the hospital.
Why?
Because you passed out, okay?
No.
We were at our party, and you took cocaine, remember? And you passed out. Okay?
Why'd you bring us here?
Because you passed out, and you couldn't breathe.
You know we're gonna get in trouble.
Okay,
Calm down.
we were at our
What's
21st birthday party, and
No, don't.
we were doing cocaine, and he passed out, and I brought him here because he couldn't breathe, and he needed to come to the hospital.
I'm fine now. We need to go home.
Well, we just
Mom and Dad are
need
gonna
to-
kill us.
I don't care.
Okay, we need to check you out really quick. Can you lay down for me for just a minute? I'm just gonna take a listen.
No, you're not.
Yeah,
No.
well, I have
Cody,
to. I have
You're
to.
let
not.
her.
I'm serious. Don't touch me.
I
I'm
have to.
serious. Don't touch me.
Okay, I have
Don't-
to
Cody,
listen.
stop.
Oh my
Stop.
gosh, you're gonna have to calm down.
Cody.
Whoa.
Stephanie, what are you doing? You can't do that.
This lady's
She's
crazy.
hitting me.
Get her out of
Pulling
here.
my hair.
Sir, it's okay.
She's crazy.
It's okay. Just calm down. We're gonna get this sorted out, okay? Just calm down. We'll be right back. Okay?
We'll come to check
All right.
on you.
Come on, Stephanie. We need to go
Yeah,
have
I
a talk.
bet you will.
Cody, what the heck? Violence toward nurses may manifest itself in numerous behaviors. Verbal abuse toward nurses is reported to be the most common form of abuse, with greater than 82% of nurses across a range of clinical environments experiencing some form of verbal abuse. Other behaviors include the opportunistic use of objects such as scissors, syringes, and stretcher poles being used as weapons against nurses. In 2016, the rate was 154 injuries for 10,000 workers in nursing in public hospitals, with an even higher rate of 228 injuries per 10,000 workers in nursing homes. In all, nearly 17,000 incidents were reported that year. Okay, Stephanie, we really need to have a talk about what just happened.
I guess.
All right, come on, we're gonna have to be here. So what I saw was you holding down the patient by his throat.
Okay, you didn't see what happened before you came in.
Okay, what happened?
He was combative. He's clearly high. His sister said that he had taken cocaine. He was hitting me. He hit me several times before that, pushed me away, wouldn't let me do any type of assessment. And then he pulled my hair and basically twisted my head around on my shoulders. That was the point where I pushed him back down onto the stretcher.
Okay. I understand that he was being combative with you, but you're supposed to be the level-headed person in the room, and you're a healthcare professional. The angrier you get with the patient, the more they're going to escalate, okay? So, you know, next time you have an experience like that, you just remember to calm down and try to keep them calm, okay?
Okay, so he wasn't going to calm down at all. So can I just leave the room and maybe ask, go out and ask for help? Or use
Yeah,
the
definitely go
bedside
ask for
and
help.
call for another nurse to come help?
Yeah, you need
or-
to ask for help.
Okay.
I mean, there's, you know, just make sure, like, you're in the room, make sure you always have access to the door, make sure that, you know, you're not giving him access to anything, like, all of your person, you know. And if he's not calming down, we could maybe, you know, give him some, like, non-coercive medication administration, something like that.
So we have to have orders for restraints and all of that. So
Yeah.
just call the doctor and
Yeah,
let him
call
know
the
what's
doctor,
going
let
on.
him know what
Okay.
happened. But, you know, we just, you need to make sure, we want to protect you, but we also want to protect our patients.
Okay.
So.
Those are really great tips.
You're welcome. Okay, Stephanie, are you ready to go back to the room now?
I think so. I think
Calm?
I think I'm a lot calmer now.
All right, good. I just want to make sure that you're okay before you go back in that
I
room.
think so. You've given me some help on that. I think I understand a little bit more about how to deal with that situation now.
Okay,
So-
good job. Well, I'm going to talk to you before we go back in the room about how I would have handled the situation and how you could improve the outcome of that situation, okay?
Okay.
Cody, we're in the
Whoa,
hospital.
Why? Why?
Because you passed out at our party.
Oh man, no.
Do you remember that at all?
No.
Okay,
No,
we're in the
why
hospital.
why did you bring us
because
here?
you passed out and you couldn't breathe.
Oh my God.
And you need to
I'm
be
fine.
seen. Okay, no, Cody,
Oh
stop.
my God.
Cody.
Oh no.
No,
No.
no, we were at our 21st birthday party
No.
and shut up. And
No.
he smoked cocaine, he sipped it, and now he passed out, and I just felt like I needed to bring him here. I don't know what's going on.
I'm fine.
No, he's not.
Mom and Dad are gonna
It's
kill
okay.
us.
I don't care. We're gonna figure out what's going on. If you really are okay, we'll let you go. Alright. Alright, my name's Jessica. I'll be your nurse tonight, okay?
Alright.
Alright. So, alright, tell me again what happened. We were at our 21st birthday party and we were just having fun and dancing, and then he sniffed cocaine and just passed out, and I brought him immediately here. Thank you. Okay.
Thanks.
And your name's Cody?
Yes.
Okay. I need to do an assessment on you. Are you okay with me touching you?
No.
No? Alright. I need to touch you in order to figure out if there's anything wrong with you. If you really are okay, we can get you out of here sooner.
Okay.
Okay. I'm gonna start by listening to your heart, okay?
Whoa, that thing's cold.
Wait. Oh, okay. Cody, stop being dramatic.
I'm tingly all over.
Alright, it's fine. Okay. Do you want me to come back later and do an assessment on you? Just get it over now, Cody.
If we can do it now, can we go home? Can we please just
Yes.
go home? Okay.
If you get it done now, you can go home.
Okay. Go ahead.
Alright. I need you to be cooperative with me, okay?
Okay.
The sooner this is done, the sooner you get out of here.
All right.
Here we go. Now listen to your lungs. Take a deep breath from it. Other side. Take a deep breath. Alright.
Does that sound okay?
Yeah. I think your heart rate's gone down. Your breath sounds so fine, okay? We might have to keep you in here for maybe 20 more minutes and then you can go home. Just observe you.
Okay.
Alright. I'll be right back. That wasn't that bad.
Nurses need to be taught appropriate interventions to use when confronted by violence. Healthcare providers admit that after violent experiences, they tend to avoid patients who have been or might be violent. This is not an appropriate intervention to deal with violence. Evidence-based research has shown that the use of code green response teams may be a good intervention for violent patients. The team uses the least restrictive measures to control the situation, such as verbal de-escalation skills and non-coercive use of medications. The results demonstrated that 85% of code green calls resulted in successful resolution of the violent incidents. Another intervention that can be used in the creation and implementation of universal precautions to be used by all clinical staff. These include: be aware the patients have the potential to strike out, wear appropriate clothing, rearrange environments in the setting that will minimize the risk of injury with objects during crisis, maintain appropriate positioning when approaching patients, keep a safe distance, and sustain the proper stance. Example, show 1/3 of the body when working with patients. Use protective personal equipment such as gloves and forearm and knee pads, and learn and use de-escalation techniques and active listening.
Wow, Jessica, if I had used some of those interventions, my situation with Cody would have turned out completely differently.
Yeah, and that's why it's important for me to teach you about those so you can utilize those tools and have a better experience next time.
It's so great to have a helpful nurse manager. Thank you so much.
You're welcome. Now that we've talked about the situation, we need to talk about how you need to report this.
Okay. So I need to report the situation?
Yeah, it's always good to report violence, even if it's towards you from a patient. The hospital needs to know about that, and
okay.
so that we can improve and what we need to do to teach nurses about that kind of stuff.
Okay, let's go have a seat. Can I sit? I'm tired.
Yeah.
Okay, so you said I need to report it. Is there a place that does the hospital? Do I need to report it to?
Yeah, there's paperwork you can fill out to submit to the hospital, and if the situation's bad enough, they'll take it from there.
Okay. So this isn't something that I'm expected to deal with at work then. I just thought that being down here in the emergency department that people like that come in high or whatever, I thought I've always heard that that's just like a workplace hazard or something like that. That it was something that I was expected to deal with down here.
It's something that you should expect to deal with, but it's not something that you should ignore.
Okay, I
It's
see.
something that needs to be dealt with, and if you experience it, it could really affect you as a nurse. And you're a big asset to the hospital, and we want to make our nurses happy. So,
Okay. Well, thank
and
you.
there's not going to be any punishment for you, not
Okay.
unless I don't think there's any evidence of that. So.
Okay. Thank you so much. I appreciate it.
Sadly, most nurses view workplace violence as a part of the job. This misconception may lead to nurses underreporting violence toward them. Nurses may fear that reporting violence will affect patient satisfaction scores or that the hospital administration will retaliate. Some don't know that the hospital's reporting policy or believe they can only report visible physical injuries. Other nurses avoid reporting violence because they believe that supervisors will question their competence, suspect that they somehow provoked the incident, or label them as troublemakers if they have no obvious physical injury. When nurses do report incidents or abuse, more than 85% do so only verbally.
Come in.
Oh, God.
Hi, Cody. I just wanted to apologize to you for earlier. That wasn't professional of me at all. I'm a nurse and I shouldn't be acting like that. I just wanted you to know I was sorry.
I accept your apology. I shouldn't have hit you. I apologize. I wasn't in my right mind.
Okay.
Okay. So you're ready for discharge now. You had a severe drop in blood pressure that caused you to pass out. So we set up a follow-up appointment for you to come back and just make sure you don't have any problems afterwards.
Okay. But you guys didn't tell my parents, did you?
No, actually, you're your only legal representative at 21, so we didn't tell mom and dad.
Another good reason being 21. We gotta go back to the party. I gotta get my weed bag.
Cody, we can't do that. I
Why?
told mom and dad on accident.
On accident?
They asked where you were and I couldn't lie.
Come on, Olivia, come on.
Violence towards a nurse can negatively affect the nurse physically as well as psychosocially. Nurses who encountered aggression in the workplace may experience anger, frustration, feelings of hopelessness, hypervigilance, post-traumatic stress disorder, and develop depression or anxiety, and even leave the nursing profession. It is important to teach nurses that it is unacceptable to be abused by patients and that the acts need to be dealt with. By creating a culture of safety and implementing evidence-based interventions, the incidence of workplace violence can be decreased and nurses protected.